that button now. Hi, everyone. Thank you so much for joining us for our July monthly meeting. We're really excited to have guest presenters from the AAKOMA project here with us today. Just before we get started, I'm going to give a couple quick announcements, and then I'm going to let us jump right into the presentation. So a couple things upcoming with NAMI Northern Virginia. We have our annual NAMI Walks is coming up on October 9th. This is our biggest fundraising and awareness event of the year. It is going to be virtual this year, but we're hoping to still bring everybody together in a great way to raise funds for our programs. You can register now to start a team and start fundraising. You can go to namiwalks.org/Northern Virginia. Or check out our social media. We have a lot of posts upcoming about what that's going to look like on Walk Day. So definitely check that out. Another quick thing that we have coming up in August, we are working with the Northern Virginia Family Network to host a back to school panel where we're bringing in school leaders from across the region to discuss what the plans are going back to school to support students and families. So far we have panelists from Arlington, Alexandria, Fairfax County, Falls Church City, as well as Prince William County, who are going to come to talk about what's going on with back to school, answer questions that parents have about what that's going to look like and what supports are going to be in place for the students and families. Be sure to follow us on social media, join our email list so you can get all the updates about everything that's happening August and moving forward. With that, I want to turn to our presenters. We're really excited for this presentation. So I'm actually going to turn it over to Kathy Springfield-Cobb and Kathy Williams to introduce themselves and get started.
Okay, good evening, everyone. I am Kathy Williams from Durham, North Carolina. And first of all, we want to say thank you, NAMI of Northern Virginia, for having us here tonight. But I am a retired educator, retired as a high school guidance counselor over 12 years ago. I like what I do in retirement, which is quite a few things. I won't go into all of it, but just grateful to be here with you all tonight and to share what we have to share from the AAKOMA project and FLOA. So thank you all for having us.
Good evening. My name is Kathy Springfield-Cobb, and I am also a retired educator / counselor. And they call us 2K because we are together 90% of the time, and we are always excited to do the work with AAKOMA and sharing information about how we can all be mentally healthy. So thank you all so much again for inviting us, and we look forward to working with you all again in the future. Thank you.
Thank you. Okay, we're going to first talk about our goals. You can, next slide. And what we'd like to do is break the silence on the stigmas and all about mental health and mental illness. So our goals tonight, it's going to be in two parts. First of all, we want to bring awareness, choice, and change, increase knowledge about mental health and how we can cope with it and help others. First, help ourselves, and then be able to help others, understand what good mental health means, and also to reinforce some coping strategies and encourage and support each other. And so the first part of the presentation will be about mental health, mainly depression. Go back, please. And then how to cope. And then the second part of the presentation is on FLOA, the FLOA model and how to help. Okay, next slide. Just take a look at this poem that this young man wrote in school. This is "Part of Me is Carolina Blue. It's full of flavor and excitement, like a wild roller coaster on the loose. But at times, I'm a deep, mean, black, lonely, and mad at the world, like a lost dog in the desert. Yet they're both true and they're both me. Let's think about that a little bit. And if you have any comments to make in reference to the poem and the pictures of the young man, just put them in the chat, and we'll read your comments or talk about your comments. Or if you have questions, just put it in the chat. We're going to come back to this later, but I just want you to see how the pictures and this young man's poem, how they can relate. Okay, next slide. We want to first talk about what is major depression. First of all, major depression is a no fault, it's a total body illness. So it affects you from head to toe, okay? And it can interfere with your life totally, your job, your appearance, your home, school, work, social life. And it's also called the world's number one health problem. It's non-discrimination, but it is a very painful illness. And it affects the organ called the brain. And when we think about illnesses, sometimes we don't think about that our brain can get sick, but it can. It's an involuntary illness. It is a physical illness too. Some people think, oh, it's just mental, but it can also be a physical illness. And it's never normal, no matter what your age is or what your life situation. Depression is never normal. But the good thing about it is it's a very treatable medical illness. And if it's left untreated, it could become a long-term disability. So it is something good about it. And remember now, it's no fault. You can't blame yourself for this illness. Next slide. So we're going to go through some signs and symptoms that we often see, especially in adolescents. They're with everybody, but our focus is adolescents. And we always say if one is experiencing at least 5 of the signs and symptoms, and it's been going on for 2 or more weeks, they need to seek help. And a lot of times these 5 symptoms, it just won't happen here and go away. It's like an everyday thing. So one is obvious unhappiness or loss of interest or pleasure. It must be one of the 5 presenting symptoms. And a lot of times you can't tell if somebody is unhappy, or, I mean, if you know them well, you know that they have lost interest or pleasure in things that they really like to do. Persistent, sad, or anxious mood, empty mood. And a lot of times you may see a weight loss or weight gain, probably more than 5%, appetite change, sleep disruptions. It could be increased sleep or decreased sleep. And as we're going through this, think about when we look at adolescents and these signs and what normally comes to our mind when we think about them. Unusual fatigue or loss of energy, feelings of worthlessness, hopelessness, or helplessness. I think we have some on the next slide. Mood swings of feeling very irritable, and it's often every day. Diminished ability to think or concentrate. And when we work with students and teachers, we always tell teachers they'll probably see this before parents see it. They'll see this diminished ability to think or concentrate or even make decisions during schoolwork. You might see frequent absences from work or school or church or whatever. You'll see them withdraw and isolate, or may have writings or drawings about depressive feelings. And a lot of times when students have to do writings in school or poetry or whatever, they will express those feelings. And some of them write very, very well. And I've heard teachers say, oh, they're just such a good writer. But when you see them writing or drawing about depressive feelings, it is a red flag to think about. And sometimes use of alcohol or drugs, which is what? Self-medicating. And or they may, their personal appearance, they may neglect that. And sometimes they have thoughts of suicide or suicide attempts. And then, we said that depression can be a physical illness. So they may have some physical symptoms that may not respond to treatment, such as headaches or digestive disorders or some kind of chronic pain. And they may take something for it and it may not respond to the treatment. Okay, next slide.
So let's look at what do people say about depression, and people have lots of thoughts about depression, but we're going to look at some of the myths of depression. Next slide. Some people say that depression is just a simple illness, whereas Ms. Williams just shared, it is not a simple illness. There are a lot of factors that play into someone being depressed. That it only lasts for a little while. And we know that that is not true. Someone suffering with depression, they're not going to just snap out of it automatically. Another myth is it does not happen in my family. We just don't have depression going on in our home. A sign of weakness or a character flaw is what some people say about someone that is dealing with depression. But we know that that is not something that someone has any control over. And lastly, ethnic groups don't get depressed or die by suicide. And that's one of the myths that we hear so often, but we know that depression, it does not discriminate. It can happen to anyone. Next slide. Now, when you're dealing with someone that is experiencing depression, we say that there are 14 worst things that you can say to someone. One being, what do you have to be depressed about? And we hear that so often. You have a great life. What do you have to be depressed about? Another one is, no one ever said that life was fair. There's a lot of people worse off than you. So why are you depressed? Well, everyone gets depressed sometimes. And we know that when someone is going through depression and they hear these things, this cannot help them in any way. Another thing that you should not say is maybe you should take vitamins for your stress. And I know Kathy has shared that a parent said that to one of her students. You just need to start taking your vitamins. Mm-hmm. Just get a hobby. That'll help you not be depressed. Or just pull yourself together, man. These are some of the worst things that you can say to someone that's dealing with depression. Next slide. Just try a little harder. And someone that's depressed, they don't want to feel the way that they're feeling, but they don't have a lot of control over it. You have no reason to feel this way, or you will be okay. Just hang on in there. It will pass. You don't like how you're feeling that way, so change it. Now, if I was feeling depressed, I would continue to feel even more depressed from someone saying, something like this to me. You have it so good. Why aren't you happy? Or I thought you were stronger than that. And lastly, snap out of it. Will you? That's when someone is feeling so frustrated with trying to deal with someone that is experiencing depression that they are just, sort of at their wits' end.
Mm-hmm. And you know what, Kathy? I believe all of us have heard somebody say at least one of these 14 things to somebody who may be experiencing depression. And especially when you look at adolescents, and this one that says you have no reason to feel this way. I have heard that so much, and they'll say, well, you don't go to work, you don't have to do anything but study. You may have a few chores. You don't have any reason to feel depressed. And so a lot of times this just shows us that when people make these comments, that they really don't know what depression is or how it affects a person when they come with these comments to them that way.
Yeah, very true. Very true. Next slide, please. But here are 7 best things to say to someone who is experiencing depression. simply saying, I love you, I care. You're not alone in this, because you want the person that's dealing with this to know that you are concerned and also you care about them and you want the best for them.
Mm-hmm.
I'm not going to leave you. Do you want a hug? Because sometimes, we can say things, but sometimes a hug is sometimes what will help, someone that is dealing with depression. I'm sorry you're in pain. And lastly, you are important to me.
Mm-hmm.
7 best things to say to someone depressed.
Right. And the thing to remember is it is a painful illness.
It is.
It's a very painful
Mm-hmm.
illness. Okay. Next slide. So we want to talk about some things that we can do for ourselves. And when we can take care of ourselves, we can definitely help take care of other people. And we just have a few here that we've listed. And one is, whatever your spirituality, praying and meditating. We always have that at the top because that can lead and guide us to wherever else we need to go. Eating healthy is important. And that's what we tell our adolescents. We know you like fast foods, but that's not always the healthiest food for you. It's okay sometimes, but make sure you're eating healthy as well and drinking plenty of water. Exercising daily, and I would say at least 30 minutes. And yoga is one of the exercises that Kathy and I do, and it really helps us. So, exercising daily, spending time with your family and your friends is very important. Very important. Getting plenty of rest and relaxation. And sometimes people feel like that's not important, but that's one of the most important things that we can do to help take care of ourselves. Because when we get enough sleep, then we're able to do some of the other things that we need to do. And just do what's best for you. Sometimes it may be people use essential oils. I remember being at the gym, and there was a young lady who I think had some kind of hyperactivity or whatever. And she said that she puts on this essential oil. I think it was Veteran or something. And it helps to calm her down. So those are the things that we probably need to know to do for ourselves, to help ourselves. You may want to go for a massage or to the spa or go get your nails done or a pedicure. And watch a good movie or just sit and listen to some good music that makes you feel good. So we first have to take care of ourselves. And if you look at this, a lot of it doesn't cost you anything
right,
to take care of yourself.
Yeah, getting out, walking in nature,
Right.
sitting on your patio, looking at the birds, all
Right.
of those things really help, to take care of yourself.
That's right. Okay, next slide. Okay, so these are some empowerment points. It's very good to write down all the positive things that have happened to you in your life, say over the past year, and especially during the pandemic. And the pandemic did bring out some positive things. I believe in a lot of us, if we just take the time to sit down and just think, about those positive things that have happened to us over the past year. And then make a list of all the positive things that people say about you. And write them down. And then you can start believing those positive things. And then make a wish list. Write down those things that you would like to have or accomplish and set a reasonable timetable to begin making them happen. Because a lot of times when we're doing things, it helps us. And it helps us when we reach our points and where we want to be. Okay, next slide. So some supportive tips, and you'll hear more about this when we get into the FLOA model, but it's very important for us to just listen. Just listen. And I'm not saying hear. Actually listen to what people are telling you, and not without judgment. and listen to what they're saying, showing empathy, encourage or assist people who need help or kind of asking you for help. And treat the person with respect and dignity. And that's like we said, no blame, do not judge them. Because when we start judging people about how they're feeling and what's going on, they won't come back to us. Give them some hope and offer or provide practical help and resources. And we always say that, share this information with family and friends, especially if we've gone through something this evening that you didn't know. Just share that information with others. You'd be surprised at how much of a difference it would make. I remember we were in a workshop and there was a young lady that went home and shared the information with her mother, and she knew something was going on with her mother. And when she showed her mother the list of symptoms of depression, the mother immediately said, okay, I admit I am feeling this way and I do want some help. So sometimes we do have to share, but know how to share it in a loving way and a no blaming way. Okay, next slide. We talked about this is the young man that we opened up with. And he says, part of me is Carolina blue, is full of flavor and excitement, like a wild roller coaster on the loose. But at times I am deep, black, mean, lonely, and mad at the world, like a lost dog in the desert. Yet they are both true and they are both me. That young man, Torian Leandros Graves, on July 13th of this past year was 25 years and he took his life. That was my son. So this is why I do this, because when we go back and we look at those signs and symptoms that we talked about, we look at maybe some of the things that people may have said. I didn't know those signs and symptoms. And they are so closely related to typical teenage behavior that we will write it off and say, oh, that's just the way teenagers are. They're just irritable. I heard a counselor say that in a workshop that I was in. Oh, my daughter, she's just irritable every day. No, people are not irritable every day. You need to look at that. And so for us, I call it the silent killer, because if you do not know those signs and symptoms of depression and suicide, it could come to anybody's home. So this is why we do what we do. We want to make people aware and give them information, if nothing more than the signs and symptoms. And then after they know, then what to do, where to go and get help for their loved one or themselves. So Torian Leandros Graves, I do it in his memory, and it's what we do. And so thank you, Torian. So, and if I had known as a parent, things would probably be different, I'm sure. Yeah. So, okay. So we'll move to the next slide. You all know I can talk about Torian forever. So we can say that there is always hope, and we can all fall prey at any time to clinical depression. I mean, it could happen to anybody. It could be situational, it could be genetic, or it can just come out of anywhere, nowhere. People always ask, well, what are they depressed about? Well, you don't have to know that, because it doesn't have to be one thing that doesn't have to be anything that they're depressed about. But if we break the silence and erase the stigma that you hear about, okay, Black people don't get depressed or Black people don't die by suicide, we will be better equipped to help those who are in need of our care and understanding. And also when we take the time to, and those of you who are on tonight, to listen and want this information, you're doing what you need to care for yourself and to care for others. We can make a difference, and it can be a difference between life and death in each other's lives. And I always wish that I could have been introduced to something of this nature, if nothing more than the signs and symptoms of depression and suicide. And then what do I do if I see this in my loved one? So anyone could fall prey of it. None of us are exempt from it. Okay, next slide. Okay.
So as Kathy, Mrs. Williams was sharing about, that we all can fall prey to depression and suicide. Our goal here too is to share with you how we can overcome, this stigma. And with AAKOMA, we're going to talk about AAKOMA FLOA and also how this can help families that are dealing with adolescents that may be experiencing depression. So next slide, please. So the mission statement and value proposition is at AAKOMA is that the AAKOMA project, our mission is to help diverse teenagers and their families achieve optimal mental health through dialogue, learning, and the understanding that everyone deserves care and support. Next slide. Receiving mental health services has been viewed as a privilege for the wealthy, and people of color oftentimes feel unwelcomed and disconnected from traditional providers. At the AAKOMA project, we're working to change those perceptions. Every person deserves optimal mental health, regardless of their background, income level, or identity. Our goals are to raise consciousness, empower people, and to shift systems. Next slide. AAKOMA FLOA is an intervention which is designed to understand and reduce embedded barriers impacting teens and youth of color. It is also a tool designed to help families pursue mental health treatment using the motivational interviewing approach, along with empirical data specific for teens of color and their families. Next slide. The population that we focus on are youth ages 11 through 17, people of color who are experiencing some sign of mental illness. And lastly, they need to have a parent or guardian willing to participate in the intervention.
Okay. And when we talk about the FLOA method, when we use providers, it could be any of these people who are listed here. Anybody with a master's level counselor, psychologist, or social worker. It could be a marital counselor, therapist. It could be your pastor, or clergy, a school services personnel, mentors. But when we use provider, we're talking about these people here listed here. Okay.
And many families are resistant to seeking treatment because they don't feel that it's a good fit. They go for a few sessions and won't go back because they share that the mental health professionals don't understand what it is that what their issues are, and they don't feel like that they are concerned. Right. So finding the provider that fits your needs is really, really important.
Right, that's right. And as people of color, we live in a complex and challenging social environment. And these include the stresses that lead to mental health concerns. And if you think about it, you think about social media, social injustice, and this past year, I think, had a great effect on us. The unsafe living environments that you see them in, school and home demands. When we were counseling high school students, we saw where the students had to work. They had to come to school, but they also had to work to help take care of their families, which is, really, really challenging for them. And then sometimes it's the body image that could be some stresses. So traditional forms of mental health care are often not the first line of treatment that's sought by teens, youth of color, and their families. They don't think about, going for treatment. They will go, and I think we probably bring this up later, but they will go to the churches, or they will go to a friend or neighbor or somebody else before they actually seek professional treatment. Okay, next slide. So why don't they want to seek the treatment? And if you think about it, and still right now, I've heard when we talked about the vaccine, I've heard, oh no, back in this Tuskegee syphilis experiment, they are on that on whatever comes up. And so it's mistrust. So sometimes they mistrust the medical professions. I even had a person in my family, there was something that happened to her son, and I think it caused traumatic stress on him. And I asked her, did the doctor recommend, a psychologist to maybe talk to him? She said, oh, yes, he did. But I don't want to take my son to no doctor. I don't trust them doctors. I said, well, what is it? But she could not answer me as to what is it she did not trust. But in my opinion, I think if the child had gone for some treatment, the behaviors that I'm seeing now in this child would not be. So it's mistrust of the medical profession, the diagnosis and treatment bias, and sometimes fear of negative repercussions. Okay. And then perception of mental illness within the community. And we've talked about that. And I think we have removed some stigma, but it's still there. And so it's how people feel about the perception of being mentally ill. And people used to use the word crazy. I don't allow them to use that around me anymore. But I think we are moving ahead, and especially with AAKOMA putting out all the information that we put out, we are educating people, making people aware of mental illness and that it could happen to anybody, and people are not crazy. And then the importance of the Black faith community and social stigma. And like I said, people will go to their pastor or somebody else before they'll go to a professional counselor. And they may need medication to help bring the chemicals back into balance. Okay, next slide. So FLOA is not a treatment through the traditional medical care, and you're going to see that as we go through it and explain. It's not a mental health treatment itself, but it just empowers the teens and their families to find the appropriate treatment for them. And it may not be where they need medication or anything, and it may be they just need, and maybe not a psychologist, but maybe a school counselor could help them through it. But so it's not a treatment. It's not a treatment, medical care. Okay. Next slide, Kathy. Is that okay? So with FLOA, we have 3 interventions. So the one is like the first 15-minute phone call, where it could be in person, that may not be a phone call, but it may be with the student or maybe with the parent. And then the second and third may be personal or virtual means. And the sessions have multiple parts. The FLOA advocate, which could be you, could be me, could be anybody, consults with the teen, or it might be the parent. In some cases, it may be the parent, but they'll consult with the teen. And then they'll consult with the parent, and then the team together, the 3 together, will consult the family together. And that's how it works. It works with the teen, or if it's not the teen, it's about the teen. Okay, and then the parent, and then the family. Okay, next slide.
Okay. As Mrs. Williams shared, there are 3 parameters of intervention. And the first interaction is to reduce barriers of engagement and establish rapport with the parents in a respectful way. And so the first thing that you would do would be to greet the person and identify yourself by name and ask to speak with the parent using the parent's first and last name because you're trying to establish rapport. Ask the parent if this is a good time to speak to them, and what you go, and the conversation is going to be brief, and it's only going to be about 15 to 20 minutes. But that's showing the parent that you respect their time. Summarize the purpose of the call, and also discuss the pros and cons of seeking treatment at present. And lastly, schedule the next interaction, whether it be virtual or in person, or an in-person meeting. All right, next slide. So FLOA is based on motivational interviewing. And motivational interviewing is an empathetic, parent, person-centered counseling approach that prepares people for change by helping them resolve ambivalence, enhance intrinsic motivation, and build confidence to change. And when using the motivational interviewing, there are some rules to follow, and we call them the rule principle. And the rule principle includes R, which is resist the writing reflex. And the writing reflex is refraining from instructing or directing or giving advice. And we know that no one wants people to give them advice or to tell them what to do. So we strongly encourage you to practice the R, to resist the writing reflex. U stands for understand the motivation. And understanding the motivation means that you're trying to draw out of the individual the reason and their commitment to change. Because before you can help someone, you have to understand what their issues are and understand their desire to want to change. L stands to listen to all parties involved. And we talk about how important it is to listen. Listening and hearing are two different things. And so we want to strongly encourage you to listen. And lastly, it's empower all parties involved. We want everyone to walk away empowered. We don't want anyone to feel like that someone has given them something to do and said, this is the best way to do it. We want you to be empowered and to make your decision about, what you want the change to be.
And that's why I think it's important to have that middle person.
Yes.
Because that's why I kind of chuckle on that right, because as parents, sometimes we want to make it right. And we don't always listen, nor do we always understand. Exactly. So it's so important to have that advocate there to help out with, the parent and the child.
Yes. Next slide, please. And so while using the MI approach, FLOA advocates will also use OARS, and OARS stands for the basic interaction technique and skills that are used early and often in the motivational interviewing approach. And so when we look at OARS, we're talking about open-ended questions. And an open-ended question is questions, that you can't just answer with a yes or no answer. So an example of that would be, how can I help you, or help me to understand? Because, you want to learn more about the person, and the more you ask open-ended questions, then you can get to know more about that individual. A stands for affirmation, and that's recognizing a person's strengths and helping the person to see that they have the power to do something different. Because if you remember at the beginning, AAKOMA's goal is always to empower. So we want to empower individuals to do something different. And an example of that would be, I appreciate you being willing to talk with me today. So that's affirming that, the person has taken the steps that they need to take to make a change. Reflective listening, and reflective listening helps the person feel that you understand the issue that they're facing from their perspective. And a lot, as we said before, some parents and students have said, I just don't feel like they understand. But when you're reflecting on what you've heard, then you're connecting with that person, and that they can say, yes, that is, what I said, or they'll say, no, that is not what I said. And so you're forming that communication and making sure that you're really, really listening. And an example of that would be, it sounds like you said, whatever. And lastly, is summary. And the summary just recaps the conversation, and it can shift the attention or direction and prepare the person to take the next step to do something different. An example of that would be, here is what I heard, or did I miss anything? So you're putting closure on the conversation that you had. And so FLOA combines MI with the trans-theoretical model of change. And we're going to look at that now. Next slide. So the trans-theoretical model of change, and we refer to it as TMOC, provides an understanding of what initiates behavior change and how specifically change can occur. And there are 5 stages, and you may experience some of these behaviors in parents or the child before they decide to get some help. So the first stage would be pre-contemplation. And that's where the person is like, they're unwilling to change a problematic behavior. They just are like, I'm not really sure that I want to do anything different. Okay, the next stage is contemplation. And so contemplation is they're considering changing their behavior. And that would be something like, well, yeah, I am seeing, that I have been sleeping a lot, or that I don't have a lot of energy. And, I may want to do something different. I just know something's different, but, so I'm acknowledging it and thinking about doing something different. Next is preparation. And this is just verbally expressing the desire to change, saying, I'm ready, just, help me to figure out what it is that I need to do. And then action is actually engaging in behavior change. And lastly, maintenance would be, once you've decided on what it is that you're going to do and that there's a plan in place, then the maintenance is continuing monitoring of the behavior change, so that the person doesn't slip back and have a relapse.
Okay. So now we're going to do a role play, and you will see the second and third steps here. This will be a parent talking with a counselor, going into the counselor's office. And it actually happened. It was actually a friend not so long ago, but we're just going to show you how it kind of works. I am the parent, and I will be going into Ms. Springfield Cobb's office in reference to my child. And I'm actually, this actually happened with me not so long ago. And it was actually a friend who was talking about her child. And I'm going to try to really imitate how she did it. Okay. All right. So I'm going into Miss Springfield Cobb's office.
Hi, come on in, Mrs. Williams. It's nice to see you. Come on in.
Good to see you too, Ms. Springfield Cobb. I know you don't have enough time, but I have just come by to talk about my child. I am really sick of him. It's a lot going on. He's not doing what he's supposed to do. His grades, first of all, his grades are falling. And he's bringing home F's, and he's really an AB student. And he's real irritable. I can't talk to him like I used to. He won't do what he needs to do around the house. He stays in his room, and he had a little job, and I'm not sure what happened, but he got fired. And so when I go in to talk to him and try to get him to do, because he just don't know how hard I work. I have to work, and all he has to do is go to school. And so he's not doing well. And I want him to continue to do well. He needs to turn in his assignments. So when I go in there to talk to him, he doesn't want to talk. And he has got to do what he's supposed to do around his house.
Well, Mrs. Williams, thank you so much for coming in, and I hear your level of concern about your son. And I know you said that you are frustrated with him.
Yes.
And you say you've noticed a lot of change in his behavior. Have you taken a few minutes to go in to your son and say, son, I've noticed some changes in your behavior, and I'd like to talk with you about that. Have you had an opportunity to do that?
Well, no, I haven't done that. You know, I've told him he needs to get on the ball. I've gone in his room and told him, you know, you need to straighten up. But we have not had a talk about his behavior. I asked him what happened on the job, but, you know, he didn't want to talk about it. So, no, we haven't had a talk. And then see, I'm raising my voice because I'm working every day. I'm a single parent and I'm really trying hard. And so, you know, it's just frustrating to come home and your child is not doing what he needs to do. And I know he can do better.
Well, Mrs. Williams, I heard you say that, you know, when you do talk with him, that your voice is raised and
It is.
And you're upset. Would you consider, you know, talking with him and, you know, going in and your voice being at a level where he, you know, where you are calm and you're talking to him and sharing with him that you are concerned and that you do love him and that you do care, and that you really would like to understand what's going on with him, because you do love him and you are concerned. Would you consider, you know, doing that and talking with him and remembering, you know, to maintain a calm demeanor when you're having a conversation with him?
I consider doing that, and I just hope he'll talk.
Okay.
You know, when I go in, I'll go in not upset and up here. I'll just try a different tone.
Okay.
And see if I can get something out of him.
Okay.
I'll consider that.
Okay. And would you follow up with me, you know, after you've had the conversation with him to let me know, you know, how did it go, and then we can decide what we need to do next. Okay.
I will.
All right.
Okay.
All right.
I'll see you next week.
Okay.
Okay. So okay. Part 2 and 3. Okay. Ms. Springfield Cobb, I hope you're doing well today. I did talk with my son and I went in calm and it worked. It really did work. And he did tell me that because of what's been going on in the family, he had 2 uncles to transition. He is not feeling well. And he did tell me that he felt like he might be somewhat depressed. He didn't want to talk about it. He had a little shame there of talking about it, but he did share that with me, and that he's not feeling good. He does like to sleep and all of that. And so I asked him if he was willing, you know, for us to talk with you, and maybe you can make some recommendations for us. And he was willing because he said he did want some help.
Well, thank you again for following up with me in reference to your son, and I'm happy to hear that he is open now to wanting to share, you know, with someone what he's thinking and feeling. I, you know, have several providers that I can give you the information, and if you'll go out and look at these, and remember too, you know, that when you're talking with the providers, you really want to look for, you know, someone that's a good fit. And so just, you know, take some time to ask them some questions and let your son, you know, also be able to ask some questions, because in order for this to work, you have to feel good about, you know, who the provider is, and also your son. So, you know, after, you know, you do that, if you'll get back with me to let me know that, you know, you found someone that you're comfortable with, and if I need to give you some more referrals, I'll be more than happy to do that as well.
Thank you so much.
Oh, you're more than welcome.
Yeah.
You're more than welcome. Thank you so much again for coming in.
Yes. Okay, so I'm going to call her back, and my son is doing much better. He's much better,
Okay.
and he's in therapy for, you know, twice a month,
Mhm.
and he's feeling a whole lot better.
Oh, I'm so glad.
And
I'm
things
so glad
with
to hear
us
that.
are a lot better, and his
Mhm.
grades are going up, and he's doing a whole lot better.
I'm so happy to hear that. And keep in touch.
Okay.
All right. Thank you so much. Mhm.
All right. So next slide.
Mhm.
Is it me?
Mhm.
Okay. So a lot of times, you may have some possible adverse events to happen, especially if when they're in therapy or seeing a provider. Some possible negative reaction to assessments or treatment, and the risk that the teen may not improve. Most of the time they do, but it is a possibility they may not improve and may even deteriorate during the treatment, possibly including suicidal behavior during the treatment. And a lot of times, if they have to go on medication, they always tell you to watch very, very closely their behaviors while on the medication, because sometimes an antidepressant may not be the right one for them, or whatever medication they're on, it could cause them to have some suicidal thoughts. So, during treatment, sometimes, especially sometimes if they're on medication, it may happen. And also participants may be notified, and we always say this, confidentiality may be broken, and that's required by state and federal regulations if there's an imminent risk of harm to themselves, or they're thinking about harming someone else, or in case of suspected abuse. We have to report it. And a lot of times, when we were counseling in school, we would always have to tell the students that. And sometimes they would be reluctant to talk, to share, because of the fact that we would have to share with parents. Okay. The next slide. And then there, of course, are potential benefits, which I think is always beneficial. Depressive symptoms and other associated mental health concerns, it could lessen. And just like with the case with the role play, his depression lessened because he was seeing a provider. And overall, the intervention is designed to be empowering for the participants. And I think also, if it helps the student, or if it helps the child, it's gonna help the parent as well. Okay. So, we're at the end of what flow is all about. And, we always say that we are each other's safe keeper, and we have to lean on each other. I don't know if you all know the song by Bill Withers, but we have this little dramatization that we do with we won't do it because we're going to be all over the place, the way our background is carrying us. But it's lean on me when you're not strong, and I'll be your friend. I'll help you carry on, for it won't be long till I'm going to need somebody to lean on. So it's saying we all need somebody to lean on, and everybody should have at least one person that they can call and lean on them, and somebody who would be an advocate for them and help them get some help. Because we all can be advocates for anybody, and allow them to lean on us, because we are each other's safekeeper. Okay. And then our next slide, I think we're actually at the end, and there are free resources. Okay. Okay. And I don't know if Tracy want to talk a little bit more on this, but there is a free therapy sessions through AAKOMA. Okay, go ahead, Tracy.
Sorry, I was trying to get this to work for me.
Okay.
Get to the here we go. So at AAKOMA, one of the things that we're able to do is we're able to help people find culturally competent providers. So if you are a young person or you're a young person, say between the ages of 13 and 30, are looking for somebody, you don't know who to contact, you can go to our website, which is just AAKOMAproject.org. And on the top, you'll see this red banner that says teens and young adults register for virtual therapy. So if you go on there, it's very simple, and it will just it'll pop up, and you just answer a couple questions. Let us know what you're looking for. Your message, you can put as little or as much. You don't need to tell us, everything. That's what, you would be talking about with your counselor, but you can let us know if you're looking for somebody who deals with certain issues or is from a certain community. And we will match you up with somebody who meets those areas, and we'll also pay for 5 virtual visits for you.
Awesome.
Awesome.
Yes. Yes. So that ends our presentation. We do want to say to NAMI, Northern Virginia, again, thank you so much for having us. And we just hope that someone listening or may listen later will be able to take away some of this information to help themselves and to help others. Because once we get this information, we are kind of responsible. And as I said earlier, I just so wish that I had been given an opportunity for this information to come to me. I think when we get this information and we start doing, we help save lives, and we help save our young people, especially who are going through crisis and don't really realize what's happening to them. We should also educate our children as well when we know. So thank you so much. Thank you, and thank you, AAKOMA, for having us as well.
Thank you.
Kathy and Kathy, thank you so much for being here. This presentation was amazing. So much great information. I had a couple questions, and I know we had one question in the chat. I know we're almost on time, but I wanted to see if we can sneak them in. Just a couple questions about the FLOA program. You might have mentioned this, but I wanted to clarify. Is there a cost to participate in the program?
No.
No, it's what we're doing is trying to teach others how to go out and do it. For an example, you can be an advocate, and someone may come to you with exactly what I went to Kathy with, and then you can get on AAKOMA FLOA to find get on the AAKOMA website and maybe find therapists or whatever. Or if you know of therapists, but we want to empower people to help other people. So any of us can be an advocate. So
there is not a cost associated with it.
No, we just want to help teach others how to help others. So correct, Tracy? Okay.
Right. But if I could add, though, if there is somebody who is specifically wanting to talk to somebody who's been trained in these principles, they could go to our website, AAKOMAproject.com. At the very bottom of the page, I think it's on every page, there's a link to our email address, and they could just send me an email that comes to me. And just call AAKOMA FLOA and say you're looking for information, you want to be matched up with somebody.
Right. Okay.
Awesome.
Thank
And
you.
if somebody wanted to become an advocate, would they do the same thing? Would they email you? What's the best way to get involved if they wanted to become an advocate and learn how to do that?
Same thing.
Great. We did have a question sent in. The question is, how can community members get involved with academic research in an authentic way?
Ladies, do you want to take that, or do you want me?
You take it.
So, that's an excellent question, because unfortunately, all too often, what we've seen is that, you had academic track over here and you had the community track over here. And honestly, that's one of the things that drew me to AAKOMA so much. Our founder, Dr. Alfie Breland Noble, she has spent 25 years or more working in where she started out in academia, but started going into the different communities. So if you're a community activist, or if you're part of a community organization, let's say a church or an organization like a family counseling group, or maybe it's even a community center, and you're looking for somebody, to see what kind of research is available. If you're local, I would say, again, contact us because Dr. Alfie is probably one of the top people in terms of community-based research in this area. And depending upon what it is that you're looking for, we're more than happy to see if there's certain things you're wanting to do. Maybe there are programs already out there that are looking for organizations like yours.
Awesome. And then I had one more question. Kathy and Kathy, I know you talked about a little bit about, finding the right provider. And I know that's a big task for a lot of people. And sometimes it can be really frustrating when you go to a provider and you know that they're not a right fit. And then you have to go through the process of finding another one. What are some recommendations you have for sort of finding out whether a provider is a right fit, either questions to ask early on or things to look for to help you get that right fit before, diving into too many sessions and then having to start all over?
Yeah, I would say, the things that we talked about earlier is that when you're having a conversation with a provider, do you feel like the provider is really listening to what your concerns are? Can you feel like that they truly understand what the issues are and can reflect those back to you? And then the other thing is that there is and we call it like a feeling that there is a connection there with that person, and that is what tends to have parents continue and students continue with the provider, is that they feel like there is a genuine connection. It's not just about, just sort of going through the motions. They feel like that person is genuinely concerned about helping them to work through the process of change. And change, it takes a long time. But if they feel like the person is invested in working with them and truly trying to understand what their issues are, then they will stay connected. Yeah.
And I would say interview them first, and with your list of questions. And then if you want to ask the advocate for a list of questions that you can ask, but always interview first, even before you go into the first session.
Right.
So, with the questions that you want answered and how they would be a good fit for you.
It looks like that's all the questions we have. And I know we are just over 7:30. So now's a good time to wrap it up. But I just wanted to thank you all again so much for coming on and presenting. And we'll definitely continue to spread the word. This presentation is recorded, which is awesome. So we can continue to share it after it. And AAKOMA is a ongoing great resource to have as part of our community. So thank you for all the work that you do.
Okay, thank you. Thank you, Megan.
Having us.
Okay.
Bye, everyone.
Thank you, Tracy.
Thank you, Tracy.
Okay, good night, everybody.